now that we have crooked teeth, we got to correct that. So braces are there. What should we go for? The metal braces or the invisible braces, the aligners?
Before we think about braces, there is actually a lot that can be done.
Oh, wow.
Even from age 3.
Hi everyone, welcome to White Swan by Shalini. Our guest today is not your typical dentist. She is a dentist, but someone who takes a holistic view on oral health. Now she's all about putting your mouth back to your body and exploring the mouth-body connection. She firmly believes that your smile is very important and that's the way you express your joy to the world. So you must take care of it. Now outside the clinic, she's a health coach, a Reiki master, and she also teaches Kundalini Yoga. So let's welcome the amazing Dr. Surinder Arora. Hi, Doctor. So happy to have you here.
Thank you so much for inviting me here. It's really an honor and a pleasure.
Nice. Doctor, could you take us through your journey of being a dentist?
Yeah, absolutely. So I was born and brought up in the UK, and I find it amazing at age 16 that we have to make a decision as to what we want to do for the rest of our lives. I find this a really astonishing thing because the decision we make at 16, what we're going to study, is going to translate into what job we essentially have in the future, right? So at that time, I did lots of work experience, and one of them was at a dental clinic. I shadowed this wonderful dentist who had a really great work-life balance, and she was going home early to be with her kids. She was doing something meaningful. And I thought, you know what? I wouldn't mind doing that. I also was thinking about doing law. So for me, it was like dentistry or law, but I chose dentistry for all of the above. So at 16, making this decision, I did my A-levels, and then I went to the University of Sheffield, and I got a wonderful education there on dentistry. So I'm really grateful for that.
Great. So thankfully you chose dentist then, being a dentist.
Yeah.
So could you tell us, when we go through the journey of teeth, could you take us through all the phases of when does a teeth erupt? Okay, when does it shed? And when do we get the permanent teeth?
When you are looking at teeth, usually the first teeth that come through are the lower A's. Okay. So you'll see something coming through the gum at the bottom. Now, if you're looking at your child and you're thinking, wait a second, they're not through yet, but I can see something else coming through, like the upper teeth, don't worry. Because sometimes they come through in different order.
Okay.
So we have the lower incisors, and then we go to the central upper incisors, and then it moves through. And the last ones to come through are going to be your second molars, and these are like after age 2 even. So after age 2, your second molars for the children are coming through, and they're the last ones that come through. So there's a whole order of eruption. And like I said, you don't need to worry if a tooth doesn't come through on time or if there's a bit of delay. Sometimes teeth are missing, and that's okay. We wouldn't really assess or do anything with that from the offset, but it's something that we might want to look into a little bit later on. Then with teeth falling out, you would expect the lower front teeth usually come out first. But before that, parents often come in and they say, hey, I think my child's getting a new tooth through at the back. And it's the first permanent molar, which is the lower 6 and the upper 6, and they come through first. So when you're looking at adult teeth, they come through behind all of the deciduous, all of the baby teeth. They come through behind. So when you're looking around age 6 and you're seeing something coming through, it's not another baby tooth, it's the first adult tooth.
Oh, is it?
Yeah.
Oh.
Yeah.
That's why I always thought that does the teeth from like the molar teeth, do they fall out and then do we get the permanent teeth? It's not that. We just get one permanent teeth.
So if you think about the dental arch, children have 20 teeth, okay? And then we need space, right? Because an adult has 32 teeth.
Right.
So where is that space going to come from?
Exactly.
We're going to have some extra space at the back, but then the other teeth that are sitting in the arch exfoliate, so they come out, and they're replaced by adult teeth.
Okay.
And we can talk about the space later on, because
Yes.
sometimes there's not enough space for them.
Yes.
But yeah, they will be coming through. And if we took an x-ray for whatever reason of the teeth, you can see all of these adult teeth
Yes.
just underneath the gum line, already in the jaw, ready to start coming out.
Oh, okay. All right. So by the age of 12, we've got all the permanent teeth, all the adult teeth.
So wisdom teeth can vary. So for some adults, they can be missing, and they can sometimes come through a little bit later on, or they can be stuck or impacted.
Okay.
Yeah.
So when can we introduce brushing to infants?
So as soon as they get their first tooth, we recommend start brushing. Now, there are some schools of thought that say, hey, start brushing the gums, get them used to it, and that's totally fine.
Mm-hmm.
You can get like a silicone head brush and you can put it on your finger,
Right.
and you can just run it around, or a damp cloth or a piece of gauze, that's also an option. And get them used to having their mouth wiped if you wish to do that. But as soon as you get that first tooth, start using a toothbrush. And this is for a few reasons: to obviously establish good oral habits.
Right.
Because later on they might be like, no, I don't want the toothbrush. And just introducing that ownership to their healthcare. I know it's a really young age to do so, but it's good to start when the first tooth comes through.
So this would be from the age of like 0 months to 8 months that they would be using the silicone finger brush.
Yeah, I mean, I don't think you need to start using anything that young, in my personal opinion. But I definitely feel as soon as you see that first tooth coming through, then start brushing. There's no harm if you want to introduce something earlier, but there are no teeth there.
Right.
So what are we actually trying to achieve by doing that? Stimulating the gums, that's fine. Getting them used to having stuff in the mouth. It might be helpful when you're introducing solids.
Okay.
But really when the first tooth comes through, that's when you want to start the cleaning habits.
How do we get our kids ready for the tooth fairy phase?
So I think a great way are books. Storytelling and books,
Right.
like sharing. I think with any transition for a child, I have 2 young children.
Yes.
It feels like sharing and talking are really important for anything, any preparation, whether it's going to preschool for the first time or whether it's your tooth is coming through. I mean, they're a bit young for that, but stopping breastfeeding, even talking to your child through all of these transitions, I think is very important. And I feel visuals and books can really help with that. So if you are somebody who is going to play tooth fairy, you can certainly introduce the tooth fairy around the time when teeth are going to be lost. And also so that child doesn't feel like it's a scary thing.
Right.
Like, my tooth is shaky, it's falling out. Well, the amazing thing is you're going to get a new set of teeth. These are your adult teeth. Look how much you're growing. And we can see in this story, look what happens when you lose a tooth.
Right.
So going through that process of it comes out and then we can put it under the pillow and you might receive something in exchange for the tooth. So whatever that looks like for parents at home as individuals.
Right. So I have a 6-year-old son. I think he's most excited about his tooth coming out because he's waiting for the tooth fairy to come and put something under his pillow.
Absolutely. What am I going to get?
Exactly. So I think he's very excited about that. I think he doesn't know yet what is going to happen, what's coming up. Right. So when we come to toothpaste, what kind of toothpaste should kids go for, as in what ingredients should we look for?
Absolutely, yeah. It's a great question. It's a question I get asked a lot. So there are a lot of different ingredients in toothpastes, and I advise every parent or caregiver to read what's on and in your products. So whether that's like food, if you're somebody who reads food labels, you want to be checking your shampoo, you want to be checking your toothpaste.
Right.
So the professional standard is to use a fluoridated toothpaste. And the recommendation, generally speaking, is you use a smear of toothpaste for ages 0 to 3 and then a pea-size amount for ages 3 to 6.
Okay.
Now, again, what fluoride does is it reverses cavities. So you put it in the mouth and there is evidence for this. It does that. But I would encourage everybody just to research and find out if that's a good fit for you, and then have a look at the other ingredients available, such as hydroxyapatite, for example, which may be helpful in doing the same thing as fluoride without some of the effects of fluoride as well.
When the kids have a transition from a flavored toothpaste to an adult toothpaste, let's call it an adult toothpaste, usually we see a lot of difficulty in that. Kids do not want to go for that adult toothpaste because it has a little different taste and the minty flavor. They do not like that. So how can we help them to move from that flavored toothpaste to an adult toothpaste?
So I guess my question is, what is the flavor made of? What is contributing to the flavor in a child's toothpaste?
Right.
So when you get something that's bright blue, I am wondering personally whether it's food coloring in a birthday cake or whether it's in a toothpaste. Why is it blue? Okay, so firstly, I would say to all parents, again, think about the ingredients list in the toothpaste. There are studies that are indicating what is in child's toothpaste may not be so suitable for every child's body.
Okay.
So check that out first of all. With the transition, you can always just choose a neutral toothpaste from the start. So if you're somebody with a young child and you're introducing toothbrushing, if you can choose a flavor that is going to be on par with what you use as a household later on or something similar, just start getting it in their mouth and exposing their palate to it. And that could even be like having like fresh mint tea in a cup. This could be something. Or yeah, like kids can have mint tea, right? Like as in just to get the flavor.
Right.
Like, oh, we don't like minty flavor.
Exactly.
We'll eat mint chocolate.
Right.
So just exposing them. And it's just about exposing the palate to different things. And yeah, it's going to be like, I don't like this toothpaste. And yeah, it's spicy and it's this and it's that. But this again comes back to what's in our toothpaste.
Right.
Like what is in our toothpaste? There's a whole long list of ingredients and you might not want to be putting all of those in your body. So if you can find something that's a little bit more neutral tasting when you start rather than like I had a mom in 2 days ago and she has a 7-year-old daughter and she said to me, can you speak to my daughter? Because we have this Australian toothpaste and it's like Chubba Chubs, lollipop flavor and cola flavor. And I was there like, this should be illegal. And what is creating that flavor?
Exactly.
Because we talk about E numbers.
Exactly.
We talk about what's in our food, but then we don't talk about what we're putting into our mouth twice a day.
That's true.
So I know that doesn't answer your question, but it's just there are questions as parents that we need to ask. What are we putting into our own bodies and what are we putting into our child's bodies? Twice a day. And the mouth absorbs everything. Okay? When somebody is having an epileptic fit, for example, we put something straight into the mouth because it gets absorbed straight into the system. When we are supplementing, for example, we have liposomal, goes underneath the tongue, goes straight into the system. Right. So that's why we really want to be thinking about what we are using to clean our teeth.
So let's address the elephant in the room. What are the causes of tooth decay?
There are so many causes of tooth decay. And the general narrative is sugar plus bacteria equals an acid equals tooth decay. That's what you're going to hear. So a lot of the time what we hear is they need to brush better. They need to eat less sugar. There's so much more to it than that. And we'll cover a little bit of it now. One of the aspects is mouth breathing, okay? If your mouth is dry, and I'm seeing so many kids that are mouth breathing now, mouths are open, mouth is drying out, the saliva is not buffering the mouth, i.e. bringing the pH back to neutral from acidic. And then the mouth is more acidic and drier, and therefore you're going to be more susceptible and prone to dental decay.
Okay.
So that's one aspect. Low vitamin D is another huge one in kids. Low vitamin D. So a lot of kids are vitamin D deficient, which is hard to believe in Singapore.
Exactly.
There's sunshine everywhere.
Right.
But where are the kids? Where are they? They're indoors.
Right.
And when I ask my patients, oh, how much outdoor play do you get? It's not that much actually when it comes down to a day. And then when they are outside, we've got hats, we've got full covered.
Right.
So our skin doesn't get that exposure to vitamin D. So then it's like, do we test for vitamin D deficiency? Do we supplement? And most kids are recommended to supplement.
All right.
And I wouldn't say do that. I wouldn't say do that blindly. I would say consult your GP, your functional doctor, your pediatrician, and then supplement accordingly with regard to the body weight and how much the body needs. But that can be a big reason. The fat-soluble vitamins, the diet, like what are we eating? So this is huge.
Right.
If you think about the Industrial Revolution, if you think about the agricultural revolution, what we are putting into our bodies has really changed.
Right.
The nutritional density of what we consume has totally shifted over time. We are not eating what our ancestors were eating.
Not at all.
We are not getting the nutrients that our body needs. We're not. And that's why there's like so many supplements and, you know, this superfood and this because our bodies need them, particularly in changing environments as well. Then there are like other things that are going on inside the body. So there are some systemic issues that can cause issues inside the mouth as well. A big thing that I see going back to nutrients is fruit. Okay. Fruit, surprisingly, Or actually, not surprisingly.
Because we encourage our kids to eat
We
fruits every
all
time.
eat 5 a day.
Yes.
5 like, where did that even come from? I'd encourage you to look that up. Where did the 5 a day come from? So essentially, this is what happens. You get acid inside the mouth. So you eat a meal, and then you have the microbiome. So you have bacteria inside the mouth. You might get a tip in the balance in the microbiome, and you get a more acidic environment. Mm-hmm. It is the acidic environment that will create a change on the enamel tooth surface. Okay. It's the acid, okay? So our mouth ideally wants to be neutral or a little bit more alkaline, and that actually goes for the whole body as well. But when there's that tip in the balance and it is frequent snacking or frequent exposure, or mouth is always open, or low fat soluble vitamins, A, D, E, and K2, when we have that, you're just more susceptible to having dental decay. Right. And that repetitive cycle is going to go and result in dental decay and dental disease. What a lot of people don't understand is it is reversible.
Right.
And it depends on essentially what we're eating. Now, if it's in the top layer of the tooth, in the enamel, like that outer surface, we can certainly reverse it. The second it's in dentine, we can't really reverse it at that point. I believe in miracles, and I've seen things happen, but clinically speaking, it's very difficult to do that because it's a fast track to the nerve in the middle, and then you're in trouble with potentially losing the tooth or a further treatment.
Right. So what are the foods that we should eat to avoid dental decay?
So anything that's going to be more alkaline for the mouth, so things like crunchy vegetables, things that are less acidic, more neutral in pH or more alkaline in pH. If you have dairy, things like cheese, some people recommend milk or coconut milk, but no added sugar. Okay. So we just need to think when we're making our food choices for our children, it's the acid that is going to cause the disruption. Okay. Acid and the sugar. The sugar breaks down and produces an acid. But we want to be looking after the oral microbiome as well. So the balance and the tip of the balance inside the mouth is also really important. And that relates to the gut microbiome. And that all relates to how we were born, how we came through, the vaginal microbiome, where we breastfed, the breast microbiome, and all that colonization of the mouth in the early years. Okay. But foods, as you were asking, so I would say anything neutral, veggies are great, cheeses are great, water, I would say water is just wonderful, just as much water as possible. Hydrated, if you want to put like a cucumber flavoring or something in that. It doesn't have to be like, you get stuff like orange squash and like these soda and carbonated beverages. They're really a disaster for the mouth. Things like Milo, absolute disaster. They're a big disaster. Because if you think about it, you're sipping it, you're putting it down. You're sipping it, you're putting it down. Every single time you get that exposure on the teeth, it's an exposure to acid, and that it's weakening the enamel. So then the acid is in function again, and then then the saliva buffers the area, and then it neutralizes, and then you have another sip, and then it's going through that whole process again. And if that keeps on happening consecutively, you're going to end up with dental decay. But I see with a lot of my patients, they come in and mom and dad are like, my child is gluten-free, dairy-free, refined sugar-free, and happy and confident and all of this. And goes to school, doesn't have cake. I'm not saying we don't have to do all of these things, but we can teach our children how to take care of their bodies from a young age.
Very true. Okay, so how many times should we brush in a day?
This question, if you speak to different dentists, they might say different things. Generally speaking, twice a day. Okay. So in children, we say once before bedtime, and the bedtime brush is very important. I'll share why in a moment. And then one other time in the day. Okay. So I appreciate in the morning, you're getting ready for school, there's a lot's happening, then you pull out the toothbrush, I don't want to brush my teeth. I get it, it's hard, it can be hard. So you can choose another time in the day. Okay. Now, some people say brush after meals as well. So this is what we want to think. When you've had a meal, and they say you have, for example, a glass of orange juice, what is going to happen to the enamel inside your mouth? It becomes softer. Now, note that enamel is the hardest structure in the body. It's harder than bone. It becomes softer. You're going to pick up a toothbrush and you're going to start rubbing the enamel. What's going to happen to it?
The enamel is going to come off slowly by slowly.
Yeah, it's going to wear down. Right. So then we get something called acid erosion. So if we're picking up our toothbrush and brushing straight away after we have eaten, we're going to be wearing down the enamel. Okay. We don't want to do that. Right. Okay. So some people say wait. If you've had something acidic, wait 30 minutes to brushing your teeth. And the reason for this is so the saliva can buffer the mouth, so everything's more neutral again, and the enamel hardens. And it takes 30 minutes for that.
So when do we need to change our toothbrush?
The American Dental Association suggests every 3 to 4 months.
Okay.
Every 3 to 4 months. Now, I was recently overseas on a beach, and you see what comes up out of the ocean. And I found a tube of toothpaste washed up on the shore amongst a plethora of other things, a shoe, glasses, like just all sorts of plastic deposits all over there. And a toothbrush. Okay, so we're saying, we're giving the instruction, let's change our toothbrushes every 3 to 4 months.
Right.
Why? They become frayed. They obviously collect bacteria.
Okay.
Think of your sponge. When you wash the dishes, you replace that periodically, right? You're using this inside your mouth to brush off that plaque, the dental plaque. And our mouths contain like 700 species of like bacteria, viruses, and fungi. And we're brushing our teeth every day. The same toothbrush we're using every day, we wash it off. So we need to look for the signs it's wearing down, that there are breakages, it's got an odor, all of these kind of things. And that's why the recommendation is that. But at the same time, I'm just like, it's such a burden on the environment. So then we can think about maybe recycling them or upcycling them or going for a bamboo toothbrush option or something like this.
So the bamboo toothbrush lasts longer, or is it?
It's not that it lasts longer. It's that when you dispose of it or recycle it, it will biodegrade.
All right.
But the bristles will not. The bristles are generally nylon, which actually only came in like 1938, like by DuPont. So they're not even, it's nothing. That's a very short amount of time that we've had nylon toothbrush bristles.
Okay. So how about electric and non-electric?
So the evidence shows that electric toothbrushes do give a better brush, and it's basically because there's like an oscillating head. It depends. There are different kinds of electric toothbrush, but an oscillating head, you hold it along the gum line and it just does the work for you. Okay. With a manual toothbrush, you can use them as effectively if you know how to. Okay. And it's really, I've got a toothbrush here, but it's really about using like a circular technique, like over the teeth. Okay. So, and going around all of the surfaces. So if you think about the number of surfaces, if I'm going over here, it's going around here, underneath and over here. It should take about 2 minutes to clean the whole mouth. Right. Realistically, with your kids, who's going to be 2 minutes? You're lucky if you get 2 seconds.
How about soft bristles and hard bristles?
So hard bristles can be quite abrasive. So they can really wear down the tooth structure and wear down the gums as well. Okay. So I tend to recommend a soft to medium bristle. Okay. And the electric toothbrushes tend to have a pressure indicator so that you're not brushing too hard. The other manual toothbrushes, you just gauge yourself with regard to the pressure. But try and avoid hard toothbrushes on kids.
So use soft bristles, basically. How important is flossing for kids?
Yeah, we can floss for kids. Again, something I've come across is what is floss made of and what is it coated in?
Wow, I didn't have any idea about that.
Do you floss?
Yes, I do. But I don't really check.
Right? And if your gums are bleeding, whatever's on this piece of floss, you're putting in between your teeth and it's going directly into the bloodstream. So again, we want to think about what's on our floss and what we're flossing with. And I do recommend flossing into dental cleaning when a child will allow you to do so. I think if you can nail the toothbrushing, this is great, but cleaning in between the teeth is also important if you can manage it.
Right. So how early on should we start with flossing with kids?
So I would say with children, once they've got their brushing and they're really happy with their brushing, you can start introducing floss yourself. So maybe age 4 onwards, but very gently. We need to understand that the gum is still developing, so we don't want to cause any trauma. You just gently take the floss and you go in between the teeth. And sometimes it's helpful if the child's head is on your lap, so their head is facing upwards so you can access all areas. Run it through and you're done. And it takes like a minute to do.
All right. So every day, right? Flossing?
Every day, ideally. Once a day.
All right. How about bad breath? What are the causes of bad breath?
There are a lot of causes of bad breath. So a simple one can be dehydration. Okay. So if we're not drinking enough water, it can come out on the breath. Another reason, mouth breathing. Again, the mouth is dry. Some medications and supplements can cause bad breath. Some foods in the diet, if we're eating a lot of garlic, onions, that can also contribute to bad breath as well. And there can also be gut dysbiosis, essentially. So if there's an imbalance in the gut, it can come, you'll see it on the tongue. So you'll see like a thick coating on the tongue. it produces something called volatile sulfur compounds, and they can have an odor. So if we're finding bad breath, there are several aspects to explore, including something else related to what's going on in the body. But you can also just have a look at the tongue. So once you've ticked all the boxes, hydration, not mouth breathing, all of this, not taking any supplements or medications, you can tongue scrape. Actually, see if there's a coating on the tongue, you just get a tongue scraper. It's like a horseshoe piece.
Right.
You take it, you run it down the tongue, and you can get off that layer of plaque there.
Right.
And then, of course, dental infections, gum disease, dental caries, all of these kind of things can cause bad breath as well.
Right. So the whiter the tongue, the worse the bad breath, the worse it is.
So I don't think it's like a scale of if it's really, really white, it's like the worst ever. It depends on your biology. But yeah, if you're seeing a coating, so a little bit of a coating is normal. So if you stick out your tongue, you'll see like there's probably a little something. Some people have no coating, but there can be like fungal infections. There can be all sorts of things. But when you're looking on the tongue, your tongue can tell you a lot about the digestion and what else is going on in the body as well. So the tongue in itself in Ayurveda is used as a diagnostic tool.
All right.
Yeah, which is amazing.
Yes.
So if you've got a coating on the tongue, generally there can be something imbalanced in the gut. So if you've got a thicker coating, a more yellow coating building up, we want to check out the gut as well. It might be a probiotic, it might be whatever, but you ideally want to see a practitioner that you can work with and help you through with it.
Ayurveda reminds me that in ancient India, they used to use those teeth cleaning twigs.
Yeah.
They used to call it Datun.
Yeah.
Made of the neem tree and the baboon tree.
Yeah.
How important is that?
So this is like, did they use toothbrushes?
No.
No, right? So
They just use
had,
those sticks.
Yeah, some mechanical way of cleaning the plaque off the teeth. So what we're doing with our toothbrushes and floss, putting the toothpaste to one side, is we are mechanically cleaning. It's like that point where you're washing the dishes and you are mechanically cleaning the food off the plate. There's no washing up liquid, you're just mechanically cleaning it off. It does a great job, right? So yeah, I mean, I think with that kind of thing, yeah, it might have got poked, maybe some dental trauma, but I don't see... There are so many different ancient ways of cleaning teeth.
So it can be a substitute for a toothbrush as well as a floss.
There are actually quite a few. There's like Miswak. Have you heard of Miswak? Yeah, there are quite a few products on the market that that claim they could replace toothbrushes. So open to exploration.
Oh, great. So, when we come to smiling, that is a lot related with our confidence.
Yeah.
And first impression when we go up to anyone is how we smile.
Yeah,
absolutely. That reflects a lot. So a big factor to that would be crooked teeth. We see a lot of kids nowadays having crooked teeth.
Yeah.
So what are the causes of those crooked teeth?
So firstly, what I would say about the smiling, I do actually feel being a dentist, you smile with your eyes. So no matter what you're doing with your mouth, it's your eyes that are going to tell a story and your eyes are the window to your soul. Unfortunately, we have a lot of programming in society as to what we should look like. However, there is an innate understanding by all of us that we intuitively know that our smiles should be straight. Every tooth should fit in. We should have a nice broad smile.
Right.
We know this intuitively as humans. Why do we know that? Because that is health. It's not about aesthetics, it's about health. So we're seeing more crooked teeth now than ever before. Why? That's what you're asking, okay?
Why?
The first thing is nutrition. We've spoken about this already. Have you heard of Weston A. Price?
No.
Okay. Weston A. Price was a dentist and an explorer. He went around in the 1930s and checked out indigenous communities all over the world.
Okay.
He was looking at their dental arches. He was looking at what they were eating. And what he found was these nice, beautiful, broad faces, all teeth through in the mouth, no dental decay. Okay, they had maybe some calculus, like built up plaque and staining. They weren't brushing their teeth. They weren't using a toothbrush and any of this. But they had these amazing nutrient-dense ancestral indigenous diets, which were taken from organ meats or whatever was local to their area. Very minimal sugars, very active lifestyles, community. And what he noticed when a train track was built or refined flour, sugar, vegetable oils entered a space, or a child went off to study somewhere and came back, that across the generation, in the same generation or the generation below, we would start to get these poorly formed facial structures. So the maxilla, the palate wouldn't be forming as fully as it could. The mandible, the lower jaw, would not be fully forming either. And the result is there's not enough space for the teeth, and the teeth are coming through crooked.
Okay.
So he found fat-soluble vitamins A, D, E, and K2 are essential for oral health. The other piece to this is, what is the density and how much are we chewing our food nowadays?
Because nowadays we get those processed food which are so soft and easy to chew.
So
And I think we're not moving our jaws that much.
Absolutely. Like, it's almost like a liquid diet sometimes,
Yes,
right?
yeah.
We're not even given the chance to chew our food and use these muscles.
Exactly.
So we know as we get older, or anyway, if we're using our muscles, our bones are strong.
Right.
So if we're not using these muscles, are our bones going to firstly develop, and then are they going to stay strong? And then when we're in a place where we've already got crooked teeth, it comes with like this high vault palate situation, the tongue's on the floor of the mouth. And then we have all this airway and sleep disordered breathing situation going on as well, the mouth breathing pandemic that we're in. And essentially, we're just not getting enough oxygen around our systems, which is translating to like low IQ, asthma, bedwetting, a plethora of other health consequences.
Okay. So not to have crooked teeth, we should have a better diet. Is that what we are getting to?
I wish it was that easy. I wish if we just had a good diet, it would be like that. Because there are genetics and epigenetics.
Right.
So what mom and dad have inherited and what they are themselves are going to translate through to the children, the offspring, essentially.
Now that we have crooked teeth, we've got to correct that. So braces are there. What should we go for? The metal braces or the invisible braces? The aligners?
Before we think about braces, there is actually a lot that can be done.
Oh, wow.
Even from age 3. Okay, so if you can see in your child that they're mouth breathing,
Milk tooth, basically.
yeah, even in that primary dentition, even when the milk teeth are in, we want to be thinking about something called myofunctional therapy.
Okay.
We want to be checking for a tongue tie. Can that child get their tongue on the palate?
Okay.
At rest, our lips should be together, our tongue should be on the palate, and we should be breathing through the nose.
Oh. Okay.
At all times. And the reason we want the tongue to be on the palate is because it's the best natural expander.
Okay.
The tongue can expand. So imagine your palate's growing like this. If your tongue's up there, it can start to shift it out a little bit, especially if you're a child.
Okay.
Because you have two sides of the palate. There's a suture in the middle that fuses around age 12 to 13. So if we're going to the dentist at age 12 to 13 and saying, I think my child needs braces, they've got crooked teeth, and they have, and their jaw is back and their teeth are out like this, we're not going to be able to correct any of this. We're just going to be compensating the teeth into a position to make it look more aesthetic.
Right. But then how do we train our kids to put their tongue above and make it rest?
So there is a whole program of exercises under the bracket of myofunctional therapy. Okay. So one of them is very easy. We can do this together now. So you put your tongue on your palate and it's just tongue clicks. So what you want to be doing is hitting the whole tongue, the whole of the tongue on the palate.
Okay.
So it's not like, it's more, yeah, that sounds better. So you should be getting the whole of the tongue up on the palate. Do that 10 times a day, twice a day. Start with that. I give that to all my patients. Start with that. There are loads more exercises. It's not just that. That's not going to do everything for you. But then you're thinking about something. Something like you can wear a little device at nighttime to help with all of this kind of thing, which is very easy to wear. Then you might be thinking about some kind of palatal expansion, so expanding the palate, getting space for the teeth. And then if you've got space for the teeth, they'll come through straight. You might just need some tidying up with orthodontics later on.
Okay.
And then you're asking me about metal and
braces,
Invisalign.
exactly.
So metal is metal and Invisalign is plastic, BPA-free plastic. It's up to you.
Okay, so any of them would be good.
Yeah, I mean, they're going to hopefully achieve the same outcome.
Same result, right?
The same outcome. But it's very case dependent.
Right.
Yeah, individual dependent.
Depends on how crooked they are.
Yeah, it does. It does. And also, we again, with this expansion, we want to try and avoid taking out teeth. We want to try and avoid losing teeth. If you're taking out teeth, you're losing space in the arch.
Okay.
And then as an adult, we have less space in this area and less space in the airway. This all relates to the airway. It all relates to the airway. So we want to try and keep the teeth in the mouth, which is why we want to expand first and then straighten up later on.
Right. So moving to holistic dentistry, what is the holistic approach to dentistry?
So a holistic approach is basically taking a whole person approach to dental healthcare. So when you come and see me, you're going to get an intake form. I'm going to ask you a lot of questions. I want to know about your medical history, your dental history, what toothpaste you're using, everything about how you clean your mouth, what your diet's like, your stress levels, are you mouth breathing, are you snoring? I want to know everything. Are you seeing any of the practitioners? Have you had any big life changes, or how is your sleep? So I really take into account the whole person. So some of the key things that I look at are airway and breathing, which is what we're just discussing now, the type of materials that we use inside your mouth. So ceramic is one option, and we have BPA-free composites available now. So we have materials that are more biocompatible with the body. I tend to work with these materials a little bit more. And I look at the nutrition and how that's impacting the system as well. I also work with a lot of other different practitioners. So if your child has an allergy and they're mouth breathing, can we send to someone to help with that, for example? So it's quite a broad range, but it's looking at you more as a whole person, and thinking about, okay, so you've got the shaky tooth at the bottom. What's going on in your relationships? What are your stress levels like? Yeah, I mean, if you're stressed in your relationship,
My tooth will be shaky.
well, no, that's a really quick, a very fast connection. But yeah, I've had people come in with raw bleeding gums that has not gone away, and they've been in a relationship, and there are connections with the gums and the teeth to energy lines in the body. And we can trace this back when we work with other practitioners to maybe it's the stress caused from this situation that is affecting the teeth. Or work stress, for example. I had a 30-year-old gentleman come in. This was about 7 years ago. He said, hey, doc, my front tooth here is shaky. One tooth in the mouth. Shaky to the point where it needed taking out. 30 years old. And we had to take it out. So we had this whole conversation of what's happening in your life right now. And his stress was just through the roof. He was like, my body is just pumped with cortisol. Now, this is obviously going to impact the immune system. It affects all the scaffolding inside the mouth as well. It affects the bone levels. And it specifically affected this one tooth, which we deep dived into later on. And he also had low vitamin D. So this was like, okay, so we take out this tooth, we can do this, but how do we stop the rest of the teeth going in that direction? But the body keeps a score. It's telling us something. It's always telling us something. If we have a cavity, if we have a backache, whatever it is, it's telling us something. It's giving us a message.
We must learn to get those signals, right?
Yeah, that's it.
You've emphasized a lot about nasal breathing.
Yeah.
Why is that so? Like, why is mouth breathing so bad?
Yeah, really good question. It's a really good question. So we know now that mouth breathing is part of this whole development situation where the jaw is not developing fully, the airway is not optimum. If we are mouth breathing, number one, the posture is slightly forward. Okay, so if you imagine a child mouth breathing, to get air into the body, this is going to affect the whole of the system because it's going to go down the neck, the spine, even the feet will be turned in slightly. So development and posture. When we are breathing through the nose, the air is filtered with nitric oxide, okay? Nitric oxide gets the oxygen to the right places in the body. You don't have that when you're mouth breathing, okay? So you can be potentially oxygen deprived, okay? And then with mouth breathing, obviously you have effects of dental decay, so a dry mouth, higher risk of dental decay, higher risk of gum disease and other oral health issues. And then the connection of mouth breathing to sleep apnea and sleep disordered breathing. So this can also link to things like tonsils, enlarged adenoids, allergies. So it's really a holistic approach looking at all of these aspects.
What is sleep apnea?
Sleep apnea is where you are asleep at night. So in your sleep, you stop breathing. So your oxygen saturation goes down. So essentially, you are deprived of oxygen for a few seconds or whatever it is at night, periodically. And it's quite a big thing, because if our body is not, oxygen is the number one nutrient. Oxygen is the number one nutrient. If we are not getting oxygen around the body, it's a problem. We can last for like X amount of time without food and water. We can last for how long without oxygen?
Right.
It's right there.
Yeah.
Right? Barely any
seconds.
time at all.
Right.
So if we are stopping breathing at night, oxygen's not going around the system, it can actually lead to a lot of health consequences, cardiovascular disease, other systemic health issues, all of it, besides anxiety, depression, tiredness, and all of that.
So is it like when a child is gasping for air in the night, is that sleep apnea?
This can, yeah.
Like that they go in and they breathe hard and then they take
Yeah.
in all the oxygen at once, it looks like.
Yeah.
Is it
Have
like
you
that?
experienced this?
It's not with my child,
Yeah.
but I've
Yeah.
heard mothers complaining about that.
Yeah, so if there's like a pause and then it's like,
Right.
there's something has happened. Why are you taking that big breath in? What has happened in your body? You've obviously, not obviously, but you potentially have stopped breathing for X amount of time, and then your body suddenly needs to get all that oxygen in. So then it's like a waking arousal, a big breath in to try and like restock the oxygen levels to get the oxygen back into the system. So it could look like that.
All right.
And it's in children and it's in adults as well. And there are a lot of other sleep disorders.
So how about
associated.
snoring then in the night?
Yeah, so snoring is another one. So this is going to be associated with mouth breathing. We're going to have potentially sometimes the tonsils can be affecting snoring as well. But again, it's something relating to less oxygen getting into the system. So it's worth investigating.
If they don't want to go, I mean, obviously mouth breathing is a big problem. So if they want to move to nasal, I mean, how can we encourage them to move to nasal breathing?
So I think the first thing is discussing this with your child and making them aware. We don't want to encourage our child to think, oh, well, there's something wrong with me, I've got a problem. But it's like, hey, let's work together on breathing through our nose. Now, I've had loads of kids in recently, and when we do myofunctional therapy, the first thing I do now is show me how you breathe.
Yeah.
Okay? Stand up, put your hands on your tummy. I want you to take a big, deep breath in. Okay? You can do this now. Okay, and then
My
breathe
diaphragm
out.
breathe.
Okay, now tell me what part of your body was moving.
My diaphragm? I mean, my abdominal.
Yeah. So with a lot of the kids, what I see is this whole thing filling up, this whole movement up,
Chest.
and the tummy going in, and
Okay.
the tummy going inwards. So the first thing is we want to show them how to breathe properly. So this
Okay.
is very simple. Lie down on the floor with a book on the tummy or hands on the tummy. Breathe in through the nose. Breathe out through the nose, and what you'll feel is like a balloon in your tummy, like blowing up and then going back down for younger children. So you can explain it something like that. Tongue clicks are another one. So getting the tongue used to being on the palate, because low tongue posture is one of the issues of why we're mouth breathing. And then there are some other exercises as well. Humming is one. So you can't hum with your mouth open. Okay. And when you're humming, I would like to think that the tongue is on the palate as well. So you're feeling the vibration of the tongue on the palate. That's also stimulating the meridian centers in the body. And like I said, there are a lot of other
They teach
exercises.
that in yoga also.
Yeah,
The humming
yeah,
part. When
yeah.
you say, oh.
Yeah. So you can use om, you can use the ong, you can use any mantra, you can use whatever you want. But yeah, absolutely. So I would just start with breathing and then encouraging the lips to be together. There are things such as mouth taping that you can use, and very specific types of tape that you would use for that.
Right.
But I would get checked by a practitioner beforehand.
All right. If you're supposed to talk to kids directly,
Yeah.
and explain them and tell them that they should not be, first of all, anxious about coming to the dentist because of all the equipments and all the machines that goes inside their mouth, and how can they have a good dental health?
So when you go and see the dentist, it can be quite fun. You get to sit on a chair, go for a ride in the chair. There's a cool light and you get to wear some cool sunglasses. And sometimes you even get a balloon. And all you need to do is open your mouth, say, ah, and the dentist will look in the mouth and explain everything that they do, hopefully beforehand, and count your teeth. And hopefully that's it. So the 3 things I will share with you about looking after your teeth are, number 1, you can brush your teeth twice a day for 2 minutes each time using a toothpaste and your toothbrush, and floss if you can. Please ask for help if you do need it. Number 2, keep your lips together and breathe through the nose. Number 3, eat a whole balanced, nutrient-dense diet. What on earth does that mean? eat lots of vegetables and healthy foods and chew your food well.
Thank you, Dr. Surinder, for being here. It was lovely having you here. I have a small gift for you.
Thank you so much. That's very kind. Thank you so much for having me. It's been lovely.
It was
Thank
a great
you.
pleasure.
Thank you. That's very kind. Thank you.
Thank you. Thank you, everyone, for tuning into this episode. You've got some great insights about dental care, some good tips and tricks, and also some valuable insights into how to keep your smile bright and healthy. See you again next time. Thank you, everyone, for tuning into all our episodes. I hope you get some great insights about parenting. Please share this episode with all your family members and your friends, and don't forget to hit that subscribe button. See you next time.